DMV, having some girl talk right now with a Baltimore native. His name is Ty, and you may have seen him on Instagram as the urban nurse. So, Ty, first and foremost, how are you?
I'm doing good right now. How you doing, Jake?
I am good. Thank you for taking a few seconds out of your busy day to chat with us. Some people may not know that you, like I said, you are a Baltimore native. You are a traveling nurse, and you are currently in New York City right now, helping to fight against COVID-19. So, first, can you explain to the DMV exactly what a traveling nurse is?
So a traveling nurse is basically like a contracted nurse that works through a travel nursing agency, and is contracted by different facilities to come and help, like, fill in the need or void in the staff, with whatever unit. So me in particular, I work in the ER, and there's a big shortage in nursing right now. So there aren't enough staff nurses to work on the floor, so they bring in contracted nurses that they don't have to come in and put through orientation, and they can, pretty much start and hit the ground running when they come to the facility.
So you got a phone call and it's from New York and they're like, hey, we need some help. Why did you decide to pack up and go to New York and help fight COVID-19?
I really wanted to just be a part of something bigger than myself. I can't remember too many historic events that have taken place in my life that, either I was old enough to understand and remember, or that I was really able to be a part of. And I just think this is like a once in a lifetime opportunity, and it'll be talked about, even past when I'm here on this earth.
Now, how has the experience been? Because you're in New York, you're out Mount Sinai Hospital. How has that experience been? I'm sure it's like none other.
Yeah, so it's a life-changing experience. It's very humbling, but at the same time, it's an experience I don't think I would have gotten anywhere else. So I'm getting to do more as a nurse and kind of just maximize my potential on a daily basis versus what I would have been able to do at home. So I'm seeing, different types of patients. I'm seeing how this COVID-19 virus and the disease process is working with different people. I feel like after this, people usually when in the medical field, like when people go to war or are out in the combat field, that's just a different type of experience that you don't get with your standard civilian nursing. So I feel like this is one of those situations where I'll be able to come out of this and I'll be one of the best nurses there is.
So you're in New York, and we know that New York has been hit hardest with COVID-19. How do you, when you get home from the day, how do you decompress? We are all very stressed out right now. Anxiety is high, and you're seeing this thing really at the forefront. You're in there every single day. So what do you do to decompress and kind of unstress yourself when you get home?
I'm gonna be honest with you. I'm still trying to figure that out.
Wow.
Because this is only my second week here, and even after getting off of work, I find myself suffering from insomnia and anxiety. I'll be having dreams that I'm at work when I'm asleep, and I wake up like I'm missing something, or did I forget to do something? So I'm actually still trying to figure that out. Right now, I'm usually a gym goer, and there are no gyms open out here, so I just invested in some equipment to, start running and try to figure out a way to kind of de-stress myself and be able to, let those things from work go.
Is there a set time limit that you'll be up in New York? I know you said you've been there for 2 weeks. Is it going to be until, they tell you can go home? Is it for the next 2 weeks? Like, how long do you plan on being up in New York?
So a typical nurse, a travel nurse contract is 13 weeks. But this one, because the need was so fast and the rates were so high, they did it for 8 weeks. They're doing it 8 weeks at a time. So my initial contract was 8 weeks. I guess I made a good impression on my unit. They asked me to extend for 2 more weeks, but I honestly don't know how they're going to be able to keep up with having so many travel nurses coming out and paying them so much for such a long period of time. So right now I'm at 10 weeks. I have a 10-week contract.
Okay. Would you stay longer if you were asked to stay longer than the 10 weeks?
So I would stay longer if I was asked, because I really like my facility and the people that I'm working with right now. But I see that the trend is increasing in different places. So I know back at home in Baltimore, D.C., the Philly area, they say those are supposed to be the next big hot points as far as increased cases. I know Florida is on the up and up. And now with looking from the healthcare perspective, now with them opening things back up, I don't see that this virus going anywhere anytime soon. So I really just want to kind of follow the trend and help out where I can, and also be able to still see different places in the country.
As a healthcare professional, you're talking to your home. This is the DMV. This is where you're from. What could you or would you say to your family, your friends, the people right here in the DMV about slowing the spread and things that they can do to prevent this virus?
Speaking to my people back at home and everybody in general, but specifically my community, you got to understand that we are at most risk because of other predisposing factors like high blood pressure, heart disease, diabetes, things of that nature that we have been suffering from for years. And we are more susceptible to being affected by the virus because if you look at the statistics that we are the biggest population that are dying from it. So I would say take it as seriously like the different movies with these big pandemics. This is serious. It's not just a joke that you see on Instagram. And I feel like because of social media and because it's so fast, the content is coming at you so quick, it's taken lightly. And this is not anything to be taken lightly. Your family is at risk. So, you putting yourself at risk is now putting your family and then their friends, and then it can just spread. So just make sure you protect yourself, cover your mouth, wash your hands, stay inside until, we have this thing and we have a plan under control.
Ty, thank you so much for taking a few seconds of your day to chat with your family, your friends, us right here in the DMV. I know you are super busy. We just heard the sirens going, so that lets us know that you are definitely hard at work. If people want to reach out to you on social media, where can they find you at?
You can find me on Instagram at The Urban Nurse, and you can also subscribe to my YouTube channel as well and get more up-to-date content and information from me at The Urban Nurse YouTube as well.
Ty, again, thank you so much. One, for taking time to talk with me. And then two, thank you for everything that you are doing to help in this fight against COVID-19. We are praying for you. We are loving on you. And we are sending you a lot of hugs from right here in the DMV. So thank you again so much.
Thank you guys so much for having me. You guys stay safe out there.
You too. Thank you so much, Ty.